Laxity, the biggest problem with aging is laxity. So let's step back a little bit. What's happening? Why do we suddenly get loose aging skin? So let's go back to the cellular level. In the medical layer, the skin cells, there's something called fibroblasts. They're your building blocks, which I love talking about. They produce collagen, elastin, and hyaluronic acid and gags. They thicken you from the inside out. If these are degrading, you have fibroblast degradation or downturning from the age of 20 plus. So you're aging from the age of 20. So suddenly, if this is becoming thinner and thinner, what you're noticing is your skin will eventually deflate like a balloon. So things will look a lot looser. So if the skin is not tight and taut, anything underneath it will start looking heavier. So with aging, you have fat pad migrations on your face, and then it goes all the way down here, and that's why you have jowling. But in terms of the cover will be looser. You have fine lines, open pores, oiliness, and wrinkles and folds because it's deflating like a balloon. That's the first thing you need to look at. The second thing you need to look at is anatomically, where is the laxity coming from? And I always say to patients when I see them in consultation, one of the key things I tend to ask is, did you lose weight or put on weight? Are you fluctuating with your weight? Because there are key areas that you don't want to put on weight in. After 35, when you put on weight here and you lose weight, this becomes loose skin. It doesn't suddenly become tighter. So you have to be very careful when you're expanding skin or reducing skin when you're losing your weight in certain areas. So in terms of laxity, what triggers it? You've got environmental, genetic, hormonal, lifestyle factors that can trigger it. Like I mentioned before, sun damage can cause cellular degradation. So all these things can melt away your building blocks of the foundation layer of your skin. How do we approach it? We look at it and we turn around and say, okay, how much tightness do you want? So if you want 100% tightness, you can do a facelift here. If you want 90% tightness, we suggest non-surgical threads. If you want 80% tightness, we can do contouring. If you want 50% tightness, we have medical machines that can give you that, just to laser you and tighten you up. And then you've got good prescription grade skincare that can give you 20 to 30% tightness. So between the 20 to 30% and the 50%, you're staying in the virgin lane. So then you're comfortable. Cumulatively, that will give you 70 to 80% tightness. Or you can stay in the non-virgin lane if you're comfortable with injectable threads and surgical procedures to give you a little bit more tightness. The other thing which I love about Laxity, especially in good prescription grade skincare, is if your formulation works on the fibroblast, on the medical layer of the skin, then it can cause upregulation of the fibroblast, i.e. you can thicken your cells from the inside out. So I always use the analogy, think about a house. If the foundation of the house is loose, you can't build on it. So then we say the foundation of the house is your facelift, your thread list and stuff like that. Then you've got the brickwork, which is your contouring, and then you've got the paintwork, which is your skin. So you have to approach laxity in a multimodal manner to figure out where is the cause of laxity coming from.